Okay, so we're going to go ahead and get started. Hello and good morning. Thank you, Dr. Williams, for taking time off on a Saturday morning or early afternoon to be with us and give this presentation. This presentation will be recorded and it will be uploaded onto our website. So you can go to autismhealth.com/monthly webinars, or, there's a navigation through our services. Any questions for today for Dr. Williams, please put in the Q&A. If you have any questions for myself or you would like to chat amongst each other, please do so in the chat. Feel free, and I'm happy to answer any questions throughout the presentation. So I'm going to go ahead and I'm going to get started with some updates for Autism Health. So first of all, welcome. Thank you again for joining us on a Saturday. I know most people are on vacation this month. So Autism Health is a 501(c)(3) nonprofit organization, and we are dedicated to funding scholarships and providing resources for families that are impacted by autism. So we are a nonprofit organization, and we do heavily depend on donations. And so every little bit helps. If you wouldn't mind scanning the QR code or going to autismhealth.com and making even just a small donation or a small monthly reoccurring donation, it would be greatly appreciated. Okay, so some quick updates. We have an upcoming event. If you are local to Southern California, we are doing a Cocktails for a Cause, and it's Newport Beach area, Costa Mesa. And our guest speaker will be Dr. Dan Goodnow. We've had him presenting for us before. And we would love to have you join us. So you can either scan the QR code or you can go to autismhealth.com/events. All of our events are in there. And then for just one more month only, we are doing our little summer fundraiser. If you can go ahead and order a couple tickets through Regal, they do have a sensory-friendly viewing days. And, 1/3 of the proceeds go to Autism Health. So you buy a ticket bundle for $30, and then a third of that goes to Autism Health. Our winter gala, I know it's a little early, but I'm promoting it. So I know it says guest speakers to be denounced, but currently we have General Michael Flynn. His grandchild is impacted by autism. We also have Del Bigtree and a few other doctors speaking. And then Kennedy is going to give me a confirmation in November if he can make it. So he said if he is available, he will be there. So it is our winter gala. It is in Jupiter, Florida at the Trump National Golf Club. And it is a formal event, and we would love to have you join us. So we have posted our Autism Health Summit for next year, which is April 29th through May 1st. It is a 3-day conference. It is a Thursday, Friday, Saturday, full day. And there is a VIP reception on Saturday evening. For July only, because it is the 250th anniversary of America, we are offering 50% off of your ticket price. So this is the only month and this is the only time that you will be able to get this discount. So if you use the discount code AHS50, you can get 50% off, and it will expire on August 1st. So get your tickets. So you can scan the QR code, or you can go to ahsconference.com, or even through Autism Health through our events. It's under there as well. So, as an organization and a national conference, we like to hear your feedback, even on our webinars. So, every month we offer an autism support group, we offer a free webinar, and we do our annual conference every year. For low-income families, we do offer free tickets. You just have to apply for a scholarship, and you can be awarded free access to attend. But we want to hear your feedback and we would love your testimonials so we can put them up on our website. How our organization has impacted you. So you can send all of that to info@autismhealth.com. And without further ado, I would like to introduce our headline speaker, Dr. Basima Williams. Dr. Williams is a board certified family medicine and functional medicine physician with more than 25 years of experience integrating conventional and functional medicine to help patients achieve optimal health. She is the founder of beingfunctional.com, providing virtual functional medicine consultations and Ultra Wellness Medical, a concierge primary care practice focused on prevention, longevity, and personalized care. Dr. Williams specializes in gut health, nutrition, and the health impacts of electromagnetic field exposure. She is passionate about identifying and addressing the root causes of chronic illnesses while empowering patients with practical, evidence-based strategies for lasting wellness. So I'd like to welcome Dr. Williams.
Hi, Tracy. Thank you so much for giving me this opportunity to speak today. And boy, are you guys busy with all those events, and they're all exciting events, especially the one in January. That sounds really awesome. And of course, the yearly summit. So that's really cool. Thank you for everyone who showed up on a Saturday morning. I know there's a million other things you could be doing. And thank you for anyone else who's going to listen to this later because it's being recorded. And I think that education is very empowering. And when you combine education with, experience, which is what I've been sort of doing for the past 15 years in functional medicine, I think you get you can move the needle of health and wellness really quickly and really well. So for us, what we did, my husband and I are both medical doctors, and we're both board certified in family medicine. And we are actually, I started a virtual practice because there weren't enough people doing functional medicine, 15 years ago when I first started. Now that certainly has proliferated. There's more availability now. My primary focus was in California with the California patients virtually, and in Missouri, the state that I live in. However, we're opening up Ultra Wellness Medical San Diego. It's called ultrawellnessmedicalsandiego.com. Right now, we're actually working on a different name, but right now, if you wanted to be a patient of that particular practice, in-person patient, go to ultrawellnessmedicalsandiego.com. We also have an ultrawellnessmedical.com in Missouri, where we're currently residing, but we will more than likely be retiring in California, so we wanted to start that practice now. So what I wanted to talk about, I do a lot of gut health. I do a lot of gut work with all my patients. Virtually all of my patients get something called a Genova stool study test. And we do a Genova stool study test with a 3-day sample. So it's not just one isolated, we do 3 days worth. We prep the body. You can't be on probiotics. You can't be on certain medications prior to obtaining your stool study test. So we do the stool study test for many reasons. But today, what I really want to focus on is the immune system and gut health. And this is what really intrigued me in functional medicine when I first started working on functional medicine. It reminded me of that thing at church we used to do a long time ago where we would do this thing with our hands. This is the church, this is the steeple, what's inside all the people. And it reminded me of the gut lining, and what was inside was the immune system. And it just shocks so many of my patients when I tell them that 70 to 80% of your immune system is actually in your gut lining. So I think it's important to really address how the gut affects the immune system because so many people, especially with COVID and other infections, I've had so many patients over the years have tremendous overwhelming benefits when they heal the gut, in terms of more energy, less brain fog, less joint pains, less skin rash, less abdominal pain. Let's face it, that's one of the biggest reasons why people come in to see me. Less constipation, less diarrhea, whatever it is, whatever their problem is they're improving their symptoms by improving their gut health. And one of the biggest areas that we're actually improving is the gut immune system. So, that is sort of how I want to set the stage today, and I'm going to go ahead and start my slide presentation now. Okay, so this presentation is called the Gut Immune Axis, How the Microbiome, Short-Chain Fatty Acids, and Secretory IgA orchestrate human immunity. And hopefully by the end of this, you'll know what the gut microbiome is, what short-chain fatty acids are, and what secretory IgA is. And this is a very tiny portion of how the immune system affects the overall gut health and overall body's immune system. So, okay, the three pillars that govern gut immunity, three things I certainly focus on in my practice is the gut microbiome, the short chain fatty acids, and the secretory IgA. Secretory IgA, by the way, is let me just go through these. The gut microbiome is, of course, the diverse bacteria and the living ecosystem, if you will, of the good bacteria and other things that live in your colon primarily. 90% of the gut microbiome lives in the colon, 10% lives in the small intestine, roughly. The messengers, which are the short chain fatty acids, these are the byproducts. In other words, this is what is made by the gut microbiome, and it sends signals not only directly to the colonocytes where most of the gut microbiome resides, but also it sends signals to the small intestinal epithelial cells, but it also has systemic manifestations. We'll talk about that later in terms of how it affects the the immune system. And of course, the defenders, antibodies, they're great, right? Our body makes antibodies. So 80% of the total antibodies your body makes are actually secretory IgA, and that is your first line of defense with your immune system. And the secretory IgA predominantly resides in mucosal tissue, including the intestinal lining. Let's talk about the gut-associated lymphoid tissue. You know how I told you about, inside is the immune system? Well, the gut-associated lymphoid tissue is what they call the immune systems. Right on the other side of the gut lining is your majority of your immune system. This gut lining is thinner than a piece of paper. So there's not much separating the inside of the body from the outside world. There's something called a lumen, and I just want to explain what a lumen is. A lumen is the inside of your small intestine. Okay, so if you were to look at a small intestine, it kind of looks like a hose. If you were to cut the hose in, in the middle, inside you'd see a hole. It's not really a hole in the small intestine, but on a hose, it would be a hole. That hole is what's called the lumen. There's a lot of things in the lumen, but that is the lumen. That is the outside world environment interacting with the inside world environment, which is right on the other side of this very, very thin layer. In fact, that layer is so thin, it's about it's about 5 times thinner than a standard piece of paper. Very thin, very delicate. There's a mucus layer protecting the top, but this is really, really important. If you were to also, the intestinal lining is not a tube that's just empty. It actually has finger-like projections on the inside, increasing the surface area where absorption of nutrients and other functional cells reside inside of the epithelial membrane. This is important because when we damage the cell lining, we significantly decrease the surface area where nutrition and other good things can be absorbed. So carbohydrates, proteins, amino acids, healthy fats, minerals, vitamins, phytonutrients, things like that. In fact, if we were to stretch out the entire lining of a healthy gut lining that had a lot of finger-like projections on the inside, it would stretch the surface area of a tennis court inside of your small intestine. That's pretty remarkable and a lot of square footage for good nutrient absorption. But when we damage it,
we may have 50% of that gut lining available, and that leads to a lot of other secondary problems. But this is sort of the layout here. The gut-associated lymphoid tissue houses a vast majority of human immune cells just beneath this tiny thin layer of cells. In fact, 70 to 80% of your immune system activity is going on there. The other thing I want to mention about the gut lining here is that your gut lining is not just what we call epithelial cells. Epithelial cells are the cells that make up the majority of the gut lining. That's where nutrients are absorbed, and so on and so forth. But intermixed in there, you'll see some of these other different looking cells. Some of them may be what we call goblet cells, which are making mucus to help protect the gut lining. Some are stem cells, which are helping to rejuvenate epithelial cell production and keep the gut lining healthy. Some of them are L cells, which make that the GLP naturally, which has so many different functions. Some of them are Panth cells, which help make antimicrobial substances, which helps protect the gut lining and also helps. It's another immune defense. Some of them are enteroendocrine cells. Those are the cells that make the majority of one of your happy hormones called serotonin, for example. So taking care of this gut lining, super important in terms of just keeping your gut health, your immune system healthy. All right, now I want to talk and just kind of also, I want to talk a little bit about what kind of what kind of immune cells are being made and manufactured in that cell layer right underneath the cell membrane. And those are the B cells, the T cells, dendritic cells, and macrophages. All of those cells, there's a combination of cells that act immediately and cells that have a delayed reaction. But all of them are being made in there and so many more. But those are important because the B cells are how your body makes the secretory IgA, which is your first line of defense. The T cells are the sort of the T cells, some of the T regulatory cells are being made right underneath the cell membrane. And those help keep the peace or help regulate the immune system from kind of going crazy and being pro-inflammatory. The dendritic cells, I call the dendritic cells sort of the Paul Revere cells. The invaders are coming. The invaders are coming. They're actually finger-like projections that cross the epithelial cell into the lumen of the small intestine and actually sense what's going on in the small intestine if there's dangers ahead. And so it's reacting appropriately. The macrophages sort of they're the cleanup crew that sort of removes the pathogens. Okay. Now, one of the first things I do when I see a patient who's complaining of gut issues and consequently all those other changes that happen downstream, right? The behavioral changes, the insomnia, the brain fog, irritability, the eczema, whatever, neuropathies, joint pains, whatever it is. I don't even pay attention to that stuff until after I have ensured that we are doing the best we can with our gut health overall. One of the first things I do is I do a stool study. And the main reason I do the stool study is because we have got to rule out potential pathogens as causing all of those downstream potential problems. Potential pathogens like certain Klebsiella species, parasites, Candida, H. pylori, we have to rule those out adequately. And that's why we do the 3-day stool study test. We actually also induce sort of a loose or diarrhea bowel movement. The last stool study we do of the 3 days because we try to break down what might be hiding in biofilms within the colon. So we get a pretty good idea of whether or not we're dealing with pathogens. Now, when I think of a stool microbiome, I think of a garden. I think of planting things like broccoli and kale and cauliflower and all these other vegetables. And if I have enough vegetables, that's the first thing. Do I have enough of what we call commensal bacteria or healthy bacteria? Do I also have a good diversity of stuff that I planted? Did I just plant green beans or did I plant 20 different things? So looking at commensal bacteria diversity, very, very important. And then also, of course, looking at the weeds, and those would be the potential pathogens. I want to make sure that our garden is not overgrown with weeds. If it is, your immune system will not work well, and you'll end up being that patient who gets chronic headaches, chronic joint pains, eczema, dermatitis, autoimmune diseases, all sorts of things. This is kind of a big deal. This is why I never work with a patient if we're not going to get a stool study test, because the last thing I want to do is be caught, sort of with my pants down, not having caught a major candida infection while we're trying to do all this other fancy stuff when we really should be addressing the candida first. So, really important. Also, your commensal bacteria are super important in terms of educating tolerance versus reactivity. So it actually teaches your immune cells early on, and this has a lifelong effect. And it's one reason why I was born in Iraq and I, used to be really dirty all the time. So when I would eat, it wasn't like a sterile environment like it is in this country. So I had a very good mix of bacteria in my diet, not only from my very good healthy food, but also just from the other things that I might have accidentally ingested. But I developed a tolerance and I developed a proper reactivity so that I'm not developing all these overreactions. These are the patients that I see that have really bad allergies, autoimmune diseases, and are very susceptible to infections that don't have a good diversity of good bacteria. And also, these are the patients I see when I see kids that were born via C-section and not superseded with the mom's vaginal bacteria. This is also why I recommend using a vaginal swab, and putting it into the baby's nose if your child was born via C-section. So the other thing it does is it helps shape immune cells, and it helps differentiation of innate immune cells. Like, for example, it helps with production of macrophages, dendritic cells, natural killer cells, T cells, B cells, all those things that we talked about before. And the most common and most important mechanism of action that it does this is through something called short chain fatty acid production. Short chain fatty acids, which we're going to talk about in a little bit, they are the byproducts of your healthy gut commensal bacteria. Okay, so we want a lot of short chain fatty acids. Okay. It also, having this commensal bacteria also helps balance T regulatory cells. It helps protect by strengthening tight junctions, increased production of short chain fatty acids, which also helps fuel the colonocytes and also some epithelial cells. It also helps with so many other things, which unfortunately we don't have time for today. So I'm going to kind of go on with our next slide. Whoops. Okay. All right. So this is just sort of a slide that talks about commensal bacteria teaching your innate immune system difference between tolerance and reactivity, and how, lack of good seeding early on in life, and or those babies that are put on antibiotics right away in life, and really having a long-term effect on their immune system. Okay, let's talk about short chain fatty acids. There are three primary short chain fatty acids that the gut microbiome, when it's healthy, makes, and they include the acetate, propionate, and butyrate. Now, think of short chain fatty acids. We all know what long chain fatty acids are. That's like the olive oil that we eat. Or medium chain fatty acids. That's like the coconut oil that we eat. And then these are short chain fatty acids. These are primarily made by your microbiome. This is very, very important because short chain fatty acids just have a wide diversity of functions. I'm going to highlight just a few, and that I want you to remember, because it not only affects the gut directly, but it also affects the immune system indirectly. So really important that we learn how to increase production of short chain fatty acids. And that is primarily two ways. One, increase good, healthy gut commensal bacteria and get rid of the bad guys. And two, have a diet that's high in fiber. So we'll get to that in a second, because the bacteria love the fiber. They produce short chain fatty acids with fiber fermentation in the colon. Okay, so butyrate is the most important one of these three to increase. So how do they work? What do they do? Well, with the immune system, T regulatory cells, which are your peacemaker cells, T regulatory cells, short chain fatty acids bind to G proteins on dendritic cells, macrophages, and other cells to promote T regulatory cell differentiation and an anti-inflammatory response. T cells are what regulates your immune system from going off the deep end when it's faced with a inflammatory response. So we need to shut that inflammatory response when the danger is over, and that Tregs certainly help with that. Short chain fatty acids, super important for this process to work. It also has epigenetic effects. Epigenetics is how genes are expressed. Okay, not your genes, but how the genes are expressed. And we can affect how genes express themselves. And one of the things that short chain fatty acids, specifically butyrate, does is it actually goes into cells. So inside of your body, it's absorbed and goes into your cells and inhibits histone decarboxylase, which increases FOXP3 gene expression, which is the master transcription factor that increases T regulatory cells, which we want more Treg cells. So this is very important to understand that we're having systemic effects on shutting down a pro-inflammatory system that our body is making. So you see things like pro-inflammatory, whether it's joint pains or even eczema, psoriasis, whatever it is, those are inflammatory responses that have gotten out of hand. This shuts it down. Now, butyrate, you can't just take butyrate or short chain fatty acids like you do with, long chain and medium chain fatty acids. It gets digested before it actually makes it to the colon. There is a special butyrate supplement that we use. Occasionally, it might be my second, third, or fourth line therapy, depending on the patient's needs, that I will use that actually has evidence of making it to where it needs to go to work. One of the biggest things that short chain fatty acids are is the fuel source for the colon cells and also some of the epithelial cells. So in other words, it's the gas for these cells. It's the energy, kind of like what we use glucose and fats and to make energy. They use the short chain fatty acids. So really important. And also because of its effect on all the inflammation cascades and things like that. It also tightens tight junctions, and it also actually affects goblet cell production of mucus. So this is really, really important to understand. Short chain fatty acids have affect your body in multiple different areas and in multiple different ways. So now the last thing I want to talk about a little bit is something called the secretory IgA. This is just another slide with butyrate exerts systemic epigenetic control, unlocking anti-inflammatory gene expression. So really important. You don't need to understand FOXP3 or what it is. The take-home message is the T regulatory cells balance immune inflammation, affecting and preventing the immune system from engaging in long-term destructive cytokine activity after an infection, which we saw as an example with COVID, that everyone understands. But trust me, there's so many other things that I've seen over the past 30 years where we have to learn how to shut the inflammation down. And the first area I go to all the time, somebody can come in with psoriasis. I don't care about your psoriasis. Let's focus on gut health. Of course, I care about the psoriasis too, but let's focus on gut health. Behavioral changes in children with autism correlates with dysbiosis, correlates with increase in intestinal permeability. So again, I don't look at the behavior changes. I look at gut health first. That's one area that I really want you to think about. Okay, now let's focus on secretory IgA. So that pink object in the middle of the screen that's super huge, that's the secretory IgA antibody. And the pokey thing that kind of looks like a COVID virus, that is the pathogen that the secretory IgA is actually binding to. So kind of, I think of the secretory IgA as a bouncer. It coats the toxins and pathogens, blocking them from entering through to the other side where the immune system's at. Of course, if it enters there, then we're going to kill it in other ways if you have a healthy immune system and gut social lymphoid tissue. But if we can prevent it from being absorbed to begin with, this complex becomes so big that it generally doesn't fit through the cells. So it traps them in the it also can trap them in the mucus and also selectively retains commensal bacteria. So not only does secretory IgA help with invaders, pathogens, toxins that you're definitely ingesting, right, day in, day out, because nothing is completely sterile. It also helps cultivate beyond the defense. It actually helps shape and cultivate a healthy gut microbiome, which then has all the other benefits. And one of the biggest things that actually helps increase IgA is the short chain fatty acids. Short chain fatty acids, specifically butyrate, is a primary trigger that increases secretory IgA production, which further goes. It's another layer of protection that your body needs for you to stay healthy. So how do you make how do you make more short chain fatty acids and therefore too secretory IgA and therefore too better mucus lining, healthier cells, all this stuff. So of course the first thing we talk about is how do we make more short chain fatty acids? Well, you increase your fiber intake. My favorite thing to tell my patients in general, if you're following a healthy dietary makeup, is to eat about 3 cups of non-starchy vegetables a day. These are just very practical. This is very practical advice, right? For pretty much everyone. Not everyone can do it because I've had patients tell me they eat 1 cup of broccoli a week. That's it. That's the only greens or any other color they get every week. And so it doesn't matter where you are. These are the goals that you're trying to attain. The other thing too is you may have so much gut pain when you eat vegetables that this might not be realistic for you. And it's okay. That's why you work with a functional medicine doctor, because we've got so many other tricks up our sleeve to help you with tolerating eventually 3 cups, sorry, 3 cups of vegetables daily. So ideally, this is what our goal is. 3 cups of non-starchy vegetables a day. Try to make them the rainbow of colors. 1 root vegetable a day. Some lentils and beans, which are high in fiber. Flaxseed, chia seeds, very high in fiber. And the more short chain fatty acids you have, what that does is that triggers the immune system to make more secretory IgA. Just one layer of protection after another with a good clean diet. Also, the other thing that you can do is you can increase your intake of vitamin A rich foods. So, carotene rich foods like sweet potatoes, carrots, leafy greens, and believe it or not, liver is really good. And then also some polyphenols like berries. The other thing I have my patients do who come in complaining of, especially diarrhea, pain with eating, is I have them start drinking bone broth every day because it's a great source of glutamine and leucine, which both help with the healing and supporting of the gut lining. And of course, colostrum. I also, there's a 12-week study that showed an increase of secretory IgA by 79% with drinking bovine colostrum every day. I actually have my parents, if they make extra milk for their babies, I'll actually have them drink about 2 ounces of their own breast milk every day because it is very, very good for human consumption, not just baby consumption, but pretty much anybody. So if you have it, utilize it, especially if you're seeing me for gut health. We're definitely going to recommend that if you're nursing and you have more than, there's some moms that just have more than what they need for their babies. So stress reduction, stress definitely affects the ability for your body to make secretory IgA because of the chronic activation of the sympathetic nervous system. I do want to mention too, very high levels of secretory IgA is a red flag because it can suggest chronic active infection, dysbiosis, parasites, yeast, whatever it is, potential pathogens, compromised intestinal permeability, food sensitivities. That's probably one of the biggest ones I see once I clean up the diet and I get rid of the gluten and maybe temporarily get rid of some dairy or even eggs. Eggs is a big one. And, this is not about completely eliminating everything forever, but it's about eliminating long enough for us to restore health and wellness in the gut lining and then slowly reintroduce celiac disease, IBS, IBD, colorectal cancer, and other immune diseases are certainly associated with a very high level of secretory IgA. Intestinal permeability, dry systemic inflammation, absolutely, because we're overactivating that immune system underneath. So we want to do everything we can to decrease that. With autism in particular, when I've had work with autism children, behavioral changes a lot of times linked with gut dysbiosis and intestinal permeability. So again, that's something I focus on when I see children with autism. I think there's a huge amount of benefit to be had with that, especially early on, if we can focus on a good, clean, healthy diet, decreasing intestinal permeability, increasing commensal bacteria. And by that process, then we're also increasing and improving immune system response. So I'm going to stop here just in case there are questions and just be, just have, let me just make sure there's nothing else here. Okay, I am going to stop now and just kind of answer any questions that might be there. Okay, I have a Q&A. Have you seen patients without an appendix have higher rate of these symptoms given that it is considered a safe house for healthy gut flora? Yes, I have seen patients having your appendix removed is actually a risk factor for something called, and this is just an example, for something called SIBO, small intestinal bacterial overgrowth, because one of the jobs of when they take out the appendix, it also affects the celiac valve. So if the majority of our gut microbiome live and flourish in the colon, if we give it easy access to go up, transcend up into the small intestine, then we end up seeing something called small intestinal bacterial overgrowth. So absolutely. And when you have small intestinal bacterial overgrowth, then you're having an inappropriate amount of work that your small intestine has to do. You end up with a lot of bloating, a lot of abdominal pain, because you have bacteria where it shouldn't be, right? And so there's a lot of things we can do for that. A lot of times using the pleomorphic herbal supplements that can really help reduce the small intestinal burden of the small intestines. So definitely something there. Um, yeah, so let's see. The next question. Should one take butyrate? So the best thing to do with butyrate is to do all those things we just discussed in terms of how to increase short chain fatty acids as a general rule. And so for my patients, we'll put them on a diet that's like, if you can tolerate beans and you know how to make them, for example, garbanzo beans, I always use dry beans. I use a pressure cooker because it really helps kind of break down some of the anti-nutrients that are in beans and makes your body tolerate them better. But man, increase your fiber intake to about 30 to 35 grams a day. But like I said earlier, there may or may not be a ability for your body to tolerate all that fiber initially. If you have SIBO, for example, and you eat broccoli, you're probably going to get bloated. Or if you eat an apple, you're probably going to get bloated. And so definitely work on naturally increasing not just butyrate, but all short chain fatty acids. And through Genova, you can actually do a stool study that measures short chain fatty acids. I would recommend doing a 3-day stool study test. It's the same cost as a 1-day stool study test. And you can actually quantify how well you're doing with increasing short chain fatty acids. And the two things that will increase butyrate naturally is changing your diet and changing your gut microbiome for something that's healthier. Okay, what can I do to lower ammonia in gut? Do all those things we just discussed in terms of anything that affects good, healthy gut microbiome. So first, analysis, look at what we're dealing with. If you have parasites, if you have H. pylori, if you have other gut bacteria that are not helpful, then you want to go after that because ultimately that is really key. That is really, really important. And then do all the things that we talked about in terms of helping the intestinal permeability, which we didn't get into great detail with today, but the bone broth is really helpful and the colostrum and L-glutamine. These are really helpful things that will help with intestinal permeability. We don't want holes in our intestinal wall. If we have holes in our intestinal wall, we're overactivating the immune system over and over and over and over. It's so busy in there. You want this part of the immune system that's on the other side of the gut lining to be really calm and bored. If you have holes in your gut lining, then big things are going through all the time. I'll use an example of an egg. If you have a piece of egg that has been broken down into these tiny little pieces, unless it is a amino acid, if a little piece of globular protein, no matter how little, if it's still a big piece of globular protein, if it goes through that little tiny hole, it'll activate your immune system over and over and over and over again, especially if you eat eggs every day. Egg protein happens to be a big one for a lot of our patients. Um, Glutamine, actually, there's this thing called tight junctions in between cells. These tight junctions are destroyed with something called zonulin. Zonulin is a protein that your body makes to allow the dendritic cells to go through the cell membrane to kind of sense what's going on in the small intestine. That's something that's very important. Remember the Paul Revere analogy? The dendrites look inside the lumen to see what dangers are coming ahead. So it's very important. But when you eat bread that has a protein called gluten in it, that actually makes like a lot more, in some people, a lot more zonulin, and it just opens up the floodgates of leaky gut and all of your problems thereafter. So, when we see joint pain and we stop gluten and the joint pain goes away, there's a direct connection to gut, intestinal permeability, and what's being allowed to go through. Can psychiatric meds destroy gut health? They are not, I, they are not beneficial for them. I will say that. There's always a way back, and that you definitely want to do with a doctor, because psychiatric meds, there's so many different types, right? And so, my goal with my patients, again, mental health, a lot of times can be rooted back into the gut. So we peel back the onion layers one at a time until we get to what's really happening at the gut level before we start tapering down some of the psychiatric medications. And then also just getting history. Like, I've had so many patients who see me on these insane amounts of psychiatric medications because of an event that happened 35 years ago or 20 years ago. And all this time they've been put on these drugs. When they try to get off of them, they sort of relapse, which is normal when you're decreasing some psychiatric medications. You have to give your body a chance to recoup and remake on its own. So really great question. That can be a lecture on its own. It's certainly important to understand that your body, for many people, has the ability to heal itself, including from psychiatric issues. However, it's going to take more than just gut health. It's going to take the exercise, the sleep, changing behaviors, getting out of bad relationships, or whatever it is. And sometimes, as a medical doctor, sometimes I have to prescribe prescriptions for some patients because it's important. All right, should one take butyrate? I already answered that one. Can you please show the slide for how to make more short chain fatty acids? Yes, I think the slides are all recorded, and so you can go back and see them. Is an oat test a good indicator of to highlight gut dysfunction? Yes and no. I prefer a stool study test and direct assessment. And also, I've seen so many stool study tests now that I can sort of put together a full picture with, for example, if someone has short amount of short chain fatty acids and a lot of weeds in their gut, a lot of dysbiotic weeds and not a lot of variety of poor diversity of gut microbiome. There's so many areas that we can start tackling, right? We can start tackling nutrition. We can start tackling with some key probiotics and things like that. Indirectly, oat testing can be an indicator because of the byproducts of what the bacteria actually make. So yes and no. I don't generally use just the oat test, primarily because I need to know exactly what I'm dealing with. So if you've got a parasite, I need to not only know what kind of parasite, but I also need to know how severe the infection is, because that dictates treatment and length of treatment. Okay. My son has SIBO during a certain therapy due to detox. It replaces. To subside the symptoms, he receives a low dose of biocidin for 2 weeks. Can I do the therapy 4 times a year, given that he has, every case is so different, so I can't make a medical recommendation on a certain patient. These are all general recommendations. not meant to be for, I'm not replacing anyone's doctor, right, with this discussion. However, every person is different. So I can't make a comment without seeing data, without seeing some of the most important things that I like to see before I make a comment on that. Should fiber be supplemented? Absolutely. There are certain fibers that we use with our patients that are tolerant, especially for patients who are one, constipated, and two, they're like, I can't eat that much fiber, I can't eat that many vegetables without getting super bloated. So there are some special fiber sources that we use that have the least amount of bloating and gas, but the most amount of efficacy, especially in terms of increasing fiber intake daily and also increasing short chain fatty acid production and also having a great bowel movement every day. We don't want a bowel movement every day. We want a great bowel movement every day. That's what our goal is for all of our patients. There's different types of fibers for different types of medical problems. I can't recommend just one, but certainly if you follow me on Instagram or anywhere else, we actually even have a course called Feel Good Gut Health. You can go to feelgoodguthealth.com. I can include a code that I'll mention. We can put that in description later, where we can give 50% off that course, just to sort of if you're really interested in really deep dive gut health. You mentioned taking supplements for SIBO. Could you elaborate which ones you recommend? So there's no supplements for SIBO. SIBO is an infection. And so what we treat SIBO with, depending on what you have, how bad it is, the protocol for SIBO could be a prescription antibiotic called Xifaxan. It could be for 10 days, 14 days, 28 days, depending on how severe the symptoms are. And then also it can be with or without pleomorphic herbs, depending on what your problem is. So there's a whole slew of different types of herbal remedies we use either by themselves solely. And when I say pleomorphic, there's sometimes a yeast along with some gut bacteria that we're trying to attack. And herbs are great for doing more than just one thing, right? So they're antibacterial, have some antiviral properties, anti-parasite properties, anti-yeast properties. So really, really great for that. What probiotics are good? The best probiotics are, in my opinion, the professional grade probiotics, primarily the ones that have a good diversity of lactobacilli, bifidobacteria, and Saccharomyces boulardii. In addition, you want them to also contain within that little capsule two major things. One is some prebiotic food for the bacteria when they explode in your colon. And then two, you want a smart pill that actually does not get degraded until it hits the area where you want that bacteria to go. Having bacteria in your small intestine is not going to serve you well. Having it in your large intestine, where most of the bacteria reside, is the best place. And again, these are things that you would learn in the Feel Good Gut Health course that we teach because, these are really important. These are actually really important questions. Next question. What do you recommend to treat pink mold? Any mold, right? So this again goes also back with the SIBO question. Mold, first, you want proper detection. So you want to look at some specialized studies for mold. And the way I treat mold or any toxin is I look at the before, during, and after picture. The before is how are my cells working? So I try to maximize cellular function. If your cells aren't making ATP because they're so toxic, I mean, one of the biggest reasons people come in to see me is I am so tired, my brain's not working. And we do a mold panel and it's positive, especially if they have positive exposure. And so, what's the point of doing detox if your cells are not working? You're just going to be even more tired. So, we want to make sure the cells are functioning well, making plenty of ATP, good mitochondrial function. That's a whole treatment by itself. Then the second step is we want to make sure that liver is working optimally. And then the third step is we want a really good binder that will bind. So the mold is put into the bile and then put into the small intestine. We want to make sure we're binding that mold really well in order to excrete it and get it out of your system safely. And that's the other thing. We want to do this safely, not make you more sick while we're detoxing. And the name of the fiber, there's so many different types of fibers, but the Guam gum-based fibers are actually least at least symptomatic when you have a patient with SIBO. And then also my number one thing I like to do though is maximize a certain type of So if we're treating just constipation and not constipation and SIBO, then I use a simple magnesium combination that I like to use a lot of times. And these are all really great questions. I really appreciate such a attentive audience. The magnesium that we primarily use is a combination of magnesium citrate and it has a botanical proprietary blend with something called triphala, which are these Chinese herbs. There's three main herbs that are in it that really, really help with constipation. What do you suggest for treating parasites in autism? The number one thing I would recommend with autism is treating the entire everything. So I don't treat just parasites. I want to look at everything because parasites will also affect the gut microbiome in other ways. So I want to look at how well you're making sure. So we do a stool study test first, quantify the type and amount of parasites, and then a lot of times we will use many times we can just use herbs for parasites, but sometimes we actually have to use a prescription medication like Alinea, for example, for a short period of time, and maybe a higher dose than normal oregano combination. And sometimes we just use herbs. It all depends on the types. There's not a cookie cutter case here. This is why functional medicine requires a 1 hour visit, the very first visit, because we really go into detail in terms of where the underlying problem is, what went wrong, and how to best treat it. Well, those are all the questions. Thanks for all the questions. I hope it's been helpful.
Okay, I
And
have just a couple for myself.
okay.
One, what are your thoughts on A2 raw dairy?
Okay, so dairy is kind of interesting because dairy has multiple different components. And the three big components are the casein, the whey protein, and then the lactose. So I'm assuming that you're talking about people who are dairy intolerant, or should I give up dairy, for gut health and all this kind of stuff. So a lot of times, number one, with dairy, we stop all dairy for 6 weeks, and then we reintroduce hard cheese. And the reason why we reintroduce hard cheese is it's primarily casein protein, and most of the lactose that was in that milk product has been digested by the bacteria in the cheese. So it's aged for about a year or more. That's where it gets that's why it's so firm and hard. So try that first. If I had, so that number one. Number two, I use a really clean whey protein powder. That's the second whey protein. That is from A2 cows from New Zealand. So we don't just use any whey protein powder to assess whether or not you can tolerate that. And then lastly, we use a really clean yogurt or something that has all three components in it, casein, whey, and lactose, to see if it's truly a lactose intolerance or truly a dairy protein intolerance. That's number one. Number two, 110%. If you can tolerate dairy, if you've done that test and you can tolerate dairy that from A2 cows, then absolutely you can drink A2 milk if you can find it.
Okay. And that was all I had. But I want to thank you for taking time out on your Saturday because I know
Oh,
you're
my
busy
pleasure.
schedule
Yeah.
during the week with your practice. And we're excited about your new practice coming to San Diego. And also, is it possible that you could send me the presentation deck as to where I could send it out?
I sure can.
Because I know a lot of people are asking about the slides,
Yes.
and especially the ones we didn't, get to go
Yeah.
through. So,
Yeah. No problem.
okay, so I will email those to everyone. The video will be edited, and it's usually up by Tuesday. Sometimes Monday afternoon, but usually by Tuesday morning. And then you just go to autismhealth.com/monthly webinars. And thank you again, everyone, for hopping on, and we appreciate your time on a Saturday. And oh wait, are there a couple more questions? Oh, there's just a couple more questions. Do you take
Okay.
insurance? I don't think.
We do not take insurance because insurance would never be able to pay for a hour visit. So what I always tell people for insurance purposes is buy the cheapest insurance that will take care of emergencies and spend the rest, and whether it's on us or on anyone else, spend it on your health. So if you have a higher deductible and you can save, $3,000 or $4,000 a year, then spend $3,000 or $4,000 a year on your health and wellness the way you choose to do it. And that's really empowering for so many of my patients. So unfortunately, the way the model currently works, to get this level of care, insurance companies wouldn't pay for it. However, if we order routine labs, like through Quest or LabCorp. And sometimes if you're Medicare age, even though we don't take Medicare, the insurance will actually pay for the stool study test. Otherwise, you're looking at about $1,500 just in studies alone, and then $700 for an hour consultation with me, $350 for the follow-up. That's not
Which is
unusual.
very reasonable.
I was going to say that is
I
actually
have to say, I know it's a lot of money, but it is very
yeah.
reasonable. I
Mhm.
know, and she's a wonderful doctor. She's
Yeah.
also an osteopathic doctor. She has a lot more training than most MDs.
Yeah.
So I
And you
just
know what? Yeah. And part of my pay comes in people getting better, which I really, really love. So, and then someone said herbs for parasites mentioned on a quick search, garlic, oregano, neem. Yep. We do all of those. And a lot of times what we do is we use can I give you an example of pleomorphic herbs that you like? There's a couple that you can look up. This combination with, like, for example, Candibactin AR combined with Candibactin BR. But what what really, really works is different depending on what's really in, what else is in your gut, because, you know, really it's a combination. A lot of times when we see parasites, we're also going to see yeast. We're going to see Klebsiella species overgrowth. We're going to see other things. So really, we want the thing that will work the best for all of them.
awesome. Well, oh, wait a minute.
Um,
The doctor's website. So
yeah.
I did put it in it's beingfunctional.com, BEING functional.com. So
Mhm. And our San Diego practice is going to actually be named Zeta Grace Wellness Center.com, but that's not up yet. So right now, if you want to be a patient in San Diego, we're taking a wait list right now, in person, not virtual, and that would be Ultra Wellness Medical San Diego.com. Okay. Well, thank you so much, everyone, for being here. Like I said, Saturday morning, you guys are up and ready to go. So, yeah, if you have any other questions, if you want to meet and greet, just go through the website, beingfunctional.com. We'd be happy to talk with you guys.
all right, thank you, everybody.
Bye bye.
Bye-bye.